Good morning, everyone, and welcome to Mile High Living. I'm Gina Bellich. In 2009, the first family-owned and operated American Vein Vascular clinic opened in Pueblo, and now they are Colorado's largest network of vein clinics. Their vein specialists perform the latest therapies to remedy vein disease, and today founder Dr. Gordon Gibbs is here to join us as well. Let's talk about really American Vein, really how you guys got started.
Good morning. So we started venous disease, which is kind of most of what we treat, is a very, very common problem. So probably 20 or 30% of the adult population has vein problems that affect their legs, that affect their quality of life. And so because of that need and because of advancements in treatments, we decided, look, there's a need for this, let's give it a try.
Now, can you give me some symptoms, maybe some common symptoms that people exhibit or have may not even realize they have vein disease?
Sure. Yeah, I can kind of give you the short answer and the long answer to that in both ways. So the symptoms that people come in with are often heaviness, aching, discomfort. Their legs just feel tired towards the end of the day. Not so much in the morning, but more so when they've been on their feet for a long period of time. They have nighttime symptoms with cramping and restlessness and that sort of thing. And the long answer of that is like, why is that those things occur? And it's because with a little anatomy, so there are small valves on the inside of the veins that open and close, and it's very common for those valves to become leaky. It's a genetic thing, so you can blame mom or dad for it. But when those valves become leaky, gravity will pull the blood in the wrong direction in the veins, and it puts them under pressure. And with time and pressure, they can get bigger, but that pressure causes discomfort, causes aching, it causes all that, the symptoms that I just mentioned towards the end of the day. So a lot of it's very treatable. It's just really a matter of identifying which veins are problematic and what it is that we can do to help them.
So when you talk about what causes these symptoms, is it just a family history of this, or is it something else?
I think it's mostly a genetic problem. So, but it's also influenced by somebody's lifestyle choices. For example, if they're very sedentary, they're probably more likely to have a problem. If they're really heavy, for women, if you've had multiple pregnancies, that can play a part of it. If you have a job where you're on your feet and you're just standing all day long, those are all things that can A, make it worse, and B, make your symptoms more pronounced.
Is this something too that maybe to go ahead and actually have an exam, that is absolutely needed to kind of determine if you have this or not?
Yeah, it really kind of depends on how it influences your quality of life. And so some people will go for years and years and years, and they say, well, this is how my legs have always felt. And yeah, they're a little bit uncomfortable. And as soon as we identify it, and many times when we treat it, they just cannot believe how much better their legs feel.
How quickly can they start to see these symptoms improve?
Well, because we're basically trying to identify veins that are abnormal, and we close those veins off with the procedures that we can do, a lot of times the symptoms are relieved very quickly. So instantly the vein is closed. Sometimes instantly the patient feels better. Most of the time they feel better within a few days. And then as any tenderness that they have related to procedure starts to subside and go away, that's when they really start to notice a difference. But sometimes, the nighttime symptoms, the cramping and the restlessness, gone.
That's good to hear. Absolutely. Well, we have had sort of a little bit of an uptick in some COVID testing again and things like that. Do you offer telehealth? Is that something that folks can do?
We do, yeah. So COVID has been very impactful for just about everybody in the country, and so we recognize that some people are fearful of coming in. We do take a lot of precautions to keep the clinics very clean, but at the same time, sometimes it's either more convenient to just do a telehealth visit, or it's safer to do so. Yes, and so we offer that. It's not a problem at all.
I know a lot of people also have more cosmetic needs, that maybe they have spider veins, varicose veins, things like that. Can you help them with that?
Sure. There's kind of an overlap with venous disease. So the pressure on the inside of the veins can cause the veins to become larger, can cause them to become unsightly, and a lot of times they hurt. And so when they hurt, we can treat that from a medical perspective, often through somebody's health insurance. But sometimes there's an overlap. They can have lots of spider veins or that sort of thing, in addition to varicose veins, in addition to symptomatic vein problems. And a lot of times we treat the symptomatic stuff and the cosmetic stuff gets better. If somebody just has no symptoms and they have a lot of spider veins, we can treat that too.
Some people a lot of times don't even make appointments or come in to probably see you or any doctor for that matter because they're worried about their insurance. You guys accept insurance, and if so, which ones?
We do. A vast majority of people that we see have health insurance, and we run their treatments through their insurance. And it really comes down to if somebody's symptoms are influencing their quality of life. Mm-hmm. If they can't sleep because of their vein problems, if they can't do their job because of their vein problems, most insurances will allow coverage in that setting. If it's simply a cosmetic concern, we can address that with the insurance companies, identify if it is going to be covered or not, and then we can come up with an arrangement out of pocket if insurance is not going to cover it.
And if you'd like to be seen in person, boy, you have 9 different locations.
We
Talk
do.
about where those are.
Yeah, so we try and keep it convenient for people. So we have locations. We have 3 locations in the Denver metro. We have Fort Collins, Vail Valley, 2 in Colorado Springs, Pueblo, Canyon City. So we try and keep it close to home.
Before we go, let's reiterate to folks how common this is, because a lot of people at home may be thinking, well, that kind of sounds like something I'm dealing with, but I'm not sure.
It is very common. And the reports that are out there are somewhere between 25 and 30% of the adult population has it. I think that probably is an underestimation of how many people actually have it, but that's how many people are truly impacted by it on a daily basis.
Dr. Gibbs, we appreciate having you here. Thank
It's
you
my
so
pleasure.
much.
Thank you.
Take back your legs. American Vein and Vascular Institute offers minimally invasive in-office treatment options for venous disease. Call their number today, 8445-MY-LEGS. That's 844-569-5347, or visit them at AmericanVein.com for more information. They paid for today's segment, and we'll be right back.